going to talk about valve replacement of the heart. My name is Easton.
I am Evan. The heart is a muscular organ that pumps blood through a person's vessels known as the circulatory system. Living people need blood as it provides oxygen and nutrients to the body. Blood also gets rid of waste, including carbon dioxide. The heart is divided into 4 chambers, the upper left and right atria, and the lower left and right ventricles. There are also veins in the heart, as you can see in the picture.
When looking at the circulatory system, this diagram shows it a little better and can help you understand how blood flows to the heart. The blood starts at the top in the vena cava and the right atrium. It then goes through the tricuspid valve into the right ventricle, and then to the pulmonary valve, and from the pulmonary valve to the pulmonary artery. From there it goes to the lungs and gets oxygen added, and then returns back to the heart through the left side. It goes to the left atrium, the left ventricle, and the aorta, and then out to the rest of the body.
Inside your heart, you have 4 heart valves. The 4 heart valves include tricuspid, pulmonary, mitral, and aortic.
The tricuspid valve closes off the upper chamber to stop blood coming in from the body. It then opens to allow blood flow to go to the lower right chamber from the top right chamber. It is also there to stop blood from flowing where it shouldn't. The pulmonary valve closes off the lower right ventricle and then opens to let blood pump from the heart to the lungs where it gets oxygen in it.
The mitral valve closes off the upper left atrium, which is also a chamber that collects the blood with oxygen in it from the lungs. It then opens and allows blood to go to the lower left side from the upper left side. The aortic valve closes off the lower left chamber before it pumps out to the rest of the body. It opens up and allows the blood to leave the heart.
As long as a person's valves are properly formed, remain flexible, and open and close right, the heart works well. If the valve doesn't close tightly, blood can leak back into the chamber, causing problems. Valve replacement surgery is needed when these things go wrong.
Today, we are fortunate to be able to talk to Saskatoon heart surgeon, Dr. Jason Orval, who has done a number of valve replacement surgeries at the Royal University Hospital.
What is heart valve replacement surgery and what are the steps to it?
So a heart valve replacement surgery would be a procedure where you replace the native valve, which is dysfunctional, with an artificial valve. There's two different main types of heart valve surgery. There's traditional open heart surgery, where we split open the chest, cut out the old valve and sew on a new valve. And there's now a percutaneous, which means we just go through the skin where we put a catheter up through the artery in the leg, and under x-ray we put the new valve up, put it inside the old valve, crush the old valve out of the way and put that valve in place. So if it's surgical, the steps are ensuring that the patient needs it, checking out whether or not the patient has other heart problems that we have to deal with at the same time. Usually that means that they need to have a coronary angiogram as well, so if they have concomitant heart disease that needs surgery as well, we know what we're dealing with. Then it's a midline sternotomy, immobilize the heart, put the patient on cardiopulmonary bypass, so you have to stop the heart, and so you need blood flow to your head and kidneys, so put a tube in the top part of the heart, put a tube in the bottom part of the heart, with blood going in, so in the right atrium, blood going out into the aorta, and then the blood circulates through a machine. So that's the bypass machine. Circulates your blood because you can't work on a beating heart in this situation. We can get access to the valve depending which valve we're trying to replace. Cut out the valve, put the new valve in, sew it in. Sew them up, done. Yeah, with percutaneous, as we talked about, you go in through the leg under x-ray with the heart is beating. We temporarily stun the heart by making it go very fast so that it stops beating. We put the new valve in place. We deploy it on a balloon. So it springs open and we deploy it on a balloon to push it against the aperture and then out. That one's obviously much quicker, right? You recover overhead for that one. The other one's a little more intensive.
Okay. So what can cause a person to need heart valve surgery?
So lots of things. So first group would be congenital, meaning you're born with a valve problem. So some of us can be born with abnormal valves right from birth. The typical ones being the aortic valve being bicuspid instead of tricuspid, so it has 2 leaflets instead of 3, wears out a little bit quicker. You can have all kinds of mitral valve problems, cleft mitral valve, what have you, those are less rare, or less common, they're more rare. The acquired type, typically related to, in most countries, rheumatic heart disease. So you develop rheumatic fever, which is an infection, and the response to that infection destroys the valves, and then eventually they become dysfunctional. They become calcified and stiff, and they don't seal, they don't close, they leak, and they become narrow and stenotic. And then probably the most common thing that we see here is age. So as people age, and then heart attacks. Would be the most common reason that we see here. As we get older, our valves evolve.
What are the risks of getting the surgery?
So the surgical risk, obviously there's always a risk of bleeding and infection whenever you cut into there. The big risk with surgery is the risk of damage to the heart. The heart's not getting blood flow, so it sometimes can be weakened even if we have people on bypass. Stroke is the big one we worry about because there's a period of time where the head's getting blood through a machine, not through the heart. And then post-operatively, usual things like pneumonia and infection and what have you. The big thing we worry about is heart dysfunction and stroke. With the percutaneous one we're put in here, obviously the risk of stroke is a bit lower, although it's still there because we're knocking stuff off that aortic valve. Risk of perforation, so if we do it percutaneously and we poke a hole in the heart, then we have to fix that. And the need for a pacemaker, because it turns out with the aortic valve, the conduction system, which you guys looked at, the wires to the heart, they live right beside that valvular structure, and we can damage that, and the need for a pacemaker.
Okay. So what type of valves do we use to replace the old ones here in Saskatoon?
Right. So for the surgical valves, we have 2 types. You have the mechanical valve, and you have the bioprosthetic valve. Those are the 2 main types. Mechanical valves are some type of mechanism, for the most part, made out of a high tensile carbon. They're metal. And there's different ones. There's the old ball and cage where a ball bounces up and down in a cage. We don't use those anymore. There's a tilting disc where the disc just tilts as the blood flows, open, close, open, close. And then the most common now is the bileaflet discs where two little leaflets open and close, open and close, open and close. Those are the mechanical ones. The bioprosthetic are made out of either pig valve, so you take a pig valve and you shell it out and you put it into a strut that we can sew in, or else you take the pericardium, this heart sac around, out of a cow, and you form it into a valve. We would probably be leaning more towards tissue valves because less need for blood thinners, what have you, but in young people we put in a mechanical valve. Okay. And then the tabby valves, the percutaneous ones, are a cow valve, and we put in percutaneous.
In general, how long does the new heart valve last?
So if you have a tissue valve by the textbook, the durability is about 10 years. Right? So after about 10 years, you're going to see that that's going to start to wear and tear, it's going to get stiff, it's going to leak, what have you. So that's why the tissue valves we put in people that are older. If you're older than 65, we put a tissue valve in. Mechanical valves are much more durable. In the textbook says about 20 years, and we see them last even longer. The difference, I don't know if the question's coming up, but the big difference is the mechanical valves are much more prone to getting infected and forming clots. And so you need to be on blood thinners lifelong, and your risk of stroke is higher with mechanical valves. So if you can get a tissue valve, you prefer it because there's less risk, long-term risk.
How long is the surgery and how long is the recovery?
Yeah. Typical valve surgery would be about 4 hours, right? Half a day, 4 hours usually. You'd usually be in a hospital for about 5 days. So the first day you would be put out, valve surgery would be done, you'd go to the ICU, you wouldn't be awake until later that day, so about 12 hours later. And then you'd be in a critical care unit for about 48 hours, and then upstairs for 3 or 4 days in hospital, and then home. Doesn't matter if it's mechanical or tissue. And the percutaneous ones that we put in, you can go home the same day or the next morning.
Okay.
What incisions do you make to get to the heart, and what do you have to cut through?
Yeah, so lots of things. So the primary incision we said is a sternal incision, so you cut through the skin, and then you split the sternum. So the way to get to the chest cavity is to cut through the middle of that sternal bone. And then with that, you can then liberate the chest cavity open. Right? Then you have to cut through there's a little tissue plane there. The main thing is the epicardial fat that you have to cut through, and then you have to cut into the pericardium in order to get to the heart itself. And then once you get into the heart, how you get to that valve is depending on what type of valve. Usually through the top, through the atrium. You cut through the atrium so you can look down.
Okay. What valve is the most operated on?
The most common valve probably is the aortic valve, just by statistics.
Okay.
How many patients do you operate each year, and is there more men or women?
So I'm an interventional cardiologist. We're the ones that do the TAVIs. But in general, the surgical burden over a year of heart valves, it's a good question. I'd probably say 200-300 a year. The proportion of men or women is getting closer, but on average it's always about 60% men and about 40% women.
Okay. Do we have robotic heart valve surgery machines in Saskatoon?
Not in Saskatoon. So there are people that do robotic surgery. I think the closest place is Toronto. So we have not adopted minimally invasive robotic surgery. The advantage to those is less of an incision. Right? You can get in with a smaller incision. You don't have to split the whole chest open. But we don't do those here.
Okay.
Is the surgery difficult? If so, why?
Difficult on the surgeon or difficult on the patient?
The surgeon.
Well, I think when it is a difficult procedure. It's one of the more complex surgeries that you do, but the amount of training you do to be a cardiovascular surgeon is a fairly standard procedure that you do. But the biggest risk to the surgery is you're trying not to affect anything else going on. You don't want to affect the coronaries, you don't want to affect the heart function, you want to make sure that you're not damaging another structure. And you are stopping a patient's heart and you have to restart it, so you got to make sure everything is reasonable. The biggest risk to surgery though is the patient's other factors. So if you're a young, healthy patient with no other issues as far as stroke or lung disease, then the risk is much lower. The risk comes down to the recovery time of the vast majority.
What types of ways do you perform the surgery?
So we kind of talked about that. Yeah, the
Yeah.
two main would be the typical surgical sternotomy, or else percutaneous insertion through the femoral artery.
Okay.
Do you do any heart valve replacements on pediatric patients?
So there's pediatric cardiologists that do that, and pediatric cardiovascular surgeons, and we no longer have that here in Saskatoon. So the closest place they would go to Edmonton to the Stollery if there was a need for pediatric valve surgery. And those kids would be complex. Usually if you need a valve replacement as a child, you were born with multiple heart problems. It's usually not just a simple valve. So the short answer is not here.
Okay. That's all our questions. Yeah.
Thanks.
Thank you. Have a good day.
Yeah, you too.
In summary, if all parts of the heart are working well, the cardiovascular system functions as it should. If the valves are damaged, a valve replacement is needed in order to have blood flow properly for a person to live a normal life. With valve replacement surgery, surgeons can fix valves either with animal parts or mechanical parts, giving people an increased life opportunity. Heart valve function is a key component of the function of our cardiovascular system.